Welcome this evening to another session of Health Talk. I am Martha Martinez in the Social Services Office at the Gail Borden Public Library. And joining me tonight, as she has for many sessions over the COVID period, is Dr. Poulos, who's in private practice. And then also joining us ongoing is Elisa Lara, nurse liaison for VNA. And bienvenidos esta noche a temas de salud. Yo soy Martha Martínez con la Oficina de Servicios Sociales de la Biblioteca Gail Borden, aquí en el centro de Elgin. Junto conmigo está la doctora Poulos, que nos ha acompañado durante toda la época de COVID y sigue aún con nosotros. Y también en delante sigue Elisa Lara con nosotros. Ella es enfermera de la clínica VNA. Okay, so tonight we will be covering several topics that are relevant coming into the fall season, which will be the vaccines that will become available for all of us, as well as those that will be needed for back to school. That's another topic that we will be covering this evening. And then we will also be covering where you can find these vaccines or where you can get these vaccines. So those are the three topics that we will cover. Esta noche vamos a cubrir tres temas. Uno va a ser las vacunas que ya están por venir ahora en el otoño, las que están por venir con el regreso a la escuela, y también vamos a hablar de dónde usted puede conseguir estas vacunas en la comunidad. Aquí empezamos con ese tema y vamos a empezar con la doctora Poulos con las vacunas.
Okay, hi there. I wanted to update you on 3 vaccines for the fall. The COVID vaccine update, the flu vaccine, and something new you might have heard about, the RSV vaccines. The COVID is not over, not gone. It's definitely better. As you can see from the slide that I got today from the health department, the rate has been steadily falling, but that doesn't mean that people still should not be aware of it. They should not let their guard down. If they have symptoms, I think should test for it. Voy a cubrir 3 vacunas para el otoño. Una es la nueva vacuna de COVID que vamos a tener fines de septiembre, la vacuna de la influenza o la gripa, y una nueva vacuna por una enfermedad que no es tan conocida, pero sí ocurre cada invierno, que se llama RSV, virus respiratorio syncytial. Just starting out with the newest COVID vaccine. There will be a new COVID vaccine. The closest that I can gather is that it'll be available at the end of September. It will be a single valent. It won't be the bivalent anymore. It'll be a single valent. It's felt that the bivalent now has outrun its usefulness because the alpha strain is just gone, and
that's the original strain.
The original strain,
right?
yeah. And
okay.
the strain that they've decided on is that the FDA encourages is the XBB 0.1, 0.5 variety of Omicron. And there's no test, you don't have to remember that. And la nueva vacuna de la COVID va a ser univalente porque el tipo original de COVID ya no está corriente en la comunidad. Habíamos tenido un montón de mutaciones y el tipo que escogieron es el tipo XBB.1.5 y lo vamos a tener probablemente fines de septiembre. So the things to know about this vaccine, it'll be available probably from 3 manufacturers: Pfizer, Moderna, the mRNA vaccine, and Novavax, which is a protein vaccine. Also, even though the government's role in distributing the vaccine and providing it for free will phase out in August, it is anticipated that anyone who wants the vaccine and needs the vaccine should be able to get it for free. For children, it'll be available through VFC, which you'll hear more about later. And I'm certain, everything I've heard is that the Medicare plans will cover it. I'm sure most private insurances will. And there's going to be a program called Bridge Access Program that is going to be set up by the government, working through health centers to specifically get this vaccine to people that have no insurance. So, la vacuna nueva va a ser por tres compañías, las dos que están muy conocidas de Pfizer y Moderna, y va a ser tipo de vacuna mRNA. La tercera compañía se llama Novavax y no es tan conocida, pero sí produce una vacuna que es de tipo de proteína. En agosto, en el mes que entra, el gobierno va a parar de distribuirlo gratis por todo el país. Pero están tratando de asegurar que todas las personas que quieren la vacuna lo pueden obtener gratis. Primero por los niños de bajos recursos, el problema de BFC, que se va a tocar más en sus temas. Por los adultos con Medicare, estoy cierta que todos los programas de parte D de Medicare lo va a cubrir. Y las aseguranzas particulares, estoy casi cierta que casi todas lo deben de cubrir. Y para personas que no tienen recursos y no tienen ningún tipo de aseguranza, el gobierno va a construir un programa que se llama Bridge Access Program, puente de acceso por la vacuna. Y estoy cierta que cuando se ponemos más cerca a septiembre que vamos a conocer más sobre este programa. So that's what I know so far about the new COVID shot. Turning to flu, the other thing, just before I turn to flu, COVID is not flu, but it might help to think about it a little bit like flu. They don't even want us to call it a booster anymore. It's just the COVID shot. I think we're going to have to get accustomed to the idea that the COVID shot is something we're going to do for our health every 6 months, every year. I'm not sure. Stay tuned. So, otra cosa es que no estamos usando la palabra refuerza, porque estamos tratando de pensar el COVID, la vacuna, como algo que lo vamos a hacer cada ratito. No sé, cada 6 meses, cada año, vamos a ver cómo está reaccionando los anticuerpos del cuerpo y con qué frecuencia vamos a tener nuevos mutaciones o tipos. Now, turning to the flu vaccine, which everyone I think is fairly well used to, the government has already sort of put out which strains. It's always a combination of influenza A and influenza B, and they always have names of places that I've never been to in the Far East, because they're very, because in fact flu as an epidemic always starts in the Pacific Basin pretty much and slowly travels eastwards, which is interesting. You can actually track it online when you see the map of how influenza is going. So we pick our vaccines based on what's current months back in Asia. So that's why they have, they're called Type A or Type B Hong Kong. That's where those names come from. So they picked which varieties are going to be in the vaccines. The availability is going to be the same as always. I'm certain through VFC, Medicare covers it. Most private insurers do, and obviously I encourage that. People do die of flu. People say, "Oh, it's just the flu." Wrong,
Well, back then they had the flu pandemic where people died, and that's actually where we originated with DNA. Because so many people died.
In 1918. Mm-hmm. Yeah, in 1918.
Mm-hmm. Yeah, that's exactly how we started because of that.
Because of visiting nurses.
Yes. Yeah. There was such a need of so many people passing away during that pandemic.
Mm-hmm. Yeah. So de la influenza, ya están preparando la vacuna para el otoño. Hay varias compañías que lo producen. Van a ser una mezcla del tipo A y tipo B. Cada año escogen los tipos basados en los tipos que están corrientes en el oriente, ¿verdad? Sí. En el oriente. Y siempre es lo pueden predict.
Predecibles, son los predecibles.
Nunca está 100%, pero es lo
más probable que va a estar surgiendo durante ese tiempo, ¿no?
Y no se olviden también que para las personas más de 65 años, el dosis es diferente, pero su médico o la clínica o la farmacia lo va a saber. One thing I didn't mention is to keep in mind that there is a different dose for seniors, slightly more potent because of the decreasing immune strength of the senior citizen. So that's also, but your provider will know that.
So would it be okay for a senior to get a regular dose, or do they have to get? It's better.
I don't know if they have to, but it's preferable, and it's readily available.
Then it's okay if they end up getting a regular dose.
Yeah, but it's not.
As long as you get vaccinated.
I don't think it's the end of the world, but I think it's much preferable to get the stronger dose, and they're so easy to find.
Right.
And you will be able to get the doses at the same time.
Yeah, you can get the COVID vaccine and the flu vaccine at the same time. Y si eso lo han está muy establecido, no te preocupes, se puede vacunar de las dos al mismo tiempo.
Y va a haber una para personas de la tercera edad con una dosis más fuerte, ¿verdad?
Sí, sí. Hasta que se puede poner en el mismo brazo, aunque yo prefiero
diferentes,
pero se
balanceas.
Pero se puede poner en el mismo
para no
brazo.
poder usar uno ni el otro.
Pero no, you can even get them in the same arm, so if you prefer. So, and the third vaccine is something relatively new. RSV has been around for, forever. It's just people aren't really as aware of it. I think that most adults aren't as aware of it, and we've often thought of it as a kid illness because it's most potent or most significant for newborns, and also up until age 2 for children that are vulnerable, like that have heart disease, lung disease, former premature infants. But it actually is a significant source of illness and even hospitalization for adults. And for many years, there's been work on producing a vaccine. There's apparently been some technical issues with producing a vaccine for children. That's still not available, but there have been 2 companies that have been able to produce a protein-based vaccine approved for over age 60. They've been, both of these vaccines, and I might as well just lump them, just call them the RSV vaccine. One is made by Pfizer, one is made by the company GSK. They're both protein-based. They're approved for over age 60 by the FDA, and they're recommended by the CDC. And once again, because it's fairly new, what I'm telling you is what I'm kind of hot off the presses. In fact, the approval was June 20th, I believe. So, hay una enfermedad que se llama RSV. No es tan conocida como debe de ser. En la mayoría de personas que lo conocen como una enfermedad de los recién nacidos o de los infantes que tienen, o niños que tienen bajos recursos por varias razones, problemas de corazón, de pulmón, prematuros, algo así. Pero lástimamente que no hay vacuna por esta edad. Hay otros tratamientos, pero vacuna hasta ahorita no, lo están tratando de investigar. Pero hay vacuna, apenas se dieron la aprobación por la FDA y el CDC por los adultos de más que 60 años, apenas el mes pasado, y se creen que lo vamos a tener en la comunidad en el otoño. Ojalá que sí. Y de lo que yo he leído de la investigación, las reacciones usuales son lo usual. Se duele el brazo, leve calentura, muy pocas curaciones, como 1 o 2 pacientes con algunas graves ocurrencias cerebrales que ni creo que son necesariamente de la vacuna, pero lo tienen que informar. So, as far as these 2 vaccines, they're both predicted to be available or hope to be available in the fall. September, I'm not sure, but we'll see. And that just because they're available doesn't necessarily mean they'll be in Elgin, but we'll try. And from what I've read, the typical side effects are pretty much the standard side effects you can anticipate from any vaccine that you're aware of. Sore arm, low-grade temp, maybe a little achiness or not feeling quite right. Very rare instances of serious side effects. The question is, am I gonna recommend it to my patients, and am I gonna get it? not to admit that I'm in that age group, of course. And but the answer is, yeah, it's a individual discussion. You know, some of my patients have already asked me and expressed an interest, and I've talked about it. I think it's particularly would be important for people that have not only are in that age group, but also have longer heart disease. And the one thing I would suggest, because it's brand new, is definitely not to get it on the same day as the others, but to pick a separate time, perhaps 30 days later, would be my suggestion, just so that way you know you've gotten the two biggies, wait, and get the new one. So, la cuestión es si yo lo voy a recomendar a mis pacientes. Pues claro, yo he tenido, apenas ayer tuvo discusión con varios pacientes que tienen un interés, que lo han leído en las noticias, y especialmente por las personas que tienen bajos recursos o problemas crónicos de pulmón o de corazón, sí lo voy a recomendar. Lo que probablemente que yo también lo estoy pensando de tomar, pero no al mismo día con las otras vacunas. Yo creo que es muy recomendable con una nueva vacuna de tenerlo aparte de las otras dos, como 30 días después.
Para asegurar que no tengamos efectos.
Sí, sí. Pues, por ejemplo, si tiene una consecuencia, un efecto secundario, que se sepa de cuál es. Y también para no estresar demasiado su cuerpo. Dos vacunas a la vez.
Nos agotamos.
Sí.
Bueno, y luego ya han hecho la combinación del mRNA y el flu. Ya el año pasado. No combinación, pero las han puesto al mismo tiempo.
Sí, sí.
Sí, ¿verdad?
Sí, sí. De tener las dos vacunas en un jeringa, yo no lo veo.
No,
esto es cierto,
sí,
por este año no se va a ocurrir. So the question was, are the vaccines, the COVID and flu, in one syringe or one vial? No. They're two separate shots, and for this year, that's all I've heard of.
That can be applied at the same time.
Yes.
Yes. Okay. Very good. Very good. Well, thank you, Doctor. Thank you for the information on that, and there will be more forthcoming as we get closer to the release dates for those vaccines. Gracias por toda la información, doctora. Ya acercándose las fechas en que estén disponibles estas vacunas, habrá más información acerca de eso. Pasamos al tema que voy a cubrir yo, que va a ser el regreso a escuelas. So we're going to touch on the topic of back to school, because does anybody know when that date is?
It's so fast. It's way too soon all the time.
August 19th or something?
August 15th.
Oh, Lord.
August 15th. So
See,
that's
too
just
soon.
Yeah, like a month away, and we're already there, back to school. So el 15 de agosto va a ser cuando empieza la escuela, y ya está sobre de nosotros esa fecha. Preparé unas láminas. I prepared some slides that you will be seeing, that show how the vaccines are required by the different school districts. There's two links that are on there, one for school district U46 and another one for school district district 301. And so if you look at it, I simplified a chart that they had on their website and just put on there vertically the grades, grade preschool, kindergarten, 2nd, 6th, 9th, and 12th, and then across the top the requirements, the medical requirements to enter school, and they do have to be completed by the time you go back to school. So there's a physical exam, a vision exam, dental, and the lead screening, and then the number of vaccines, and that's going to vary according to the grade level that your child will be entering. For the vaccines, I didn't list them all. If you go to the links that I have on there, you will see a listing of the exact vaccines and the numbers of doses, and then other pertinent information. So I just gave you here an idea of how many vaccines are happening for each of those. As you see, quiero decirles que hice esta lámina con la información que saqué de los enlaces que verán ustedes en la página que están viendo ahorita. Una es para el distrito U46 y el otro para el distrito 301. En ellas verán ustedes una lámina más complicada con información que yo he simplificado aquí. Verán ustedes los diferentes niveles de escuela, de clases que requieren vacunas. Y luego van a ver también los diferentes exámenes, tanto como el examen físico, el de visión, el dental, y también para el plomo y el número de vacunas. Y no, aquí no tengo lista de eso, pero si van al enlace que está proveído van a ver que cuáles son las vacunas, cuántas dosis y toda la información con respecto a eso. También tengo hacerles saber, y Elisa va a hablar un poquito más acerca de esto también, y pues la doctora también ya nos ha hablado. We will be talking about where you can go get these vaccines and these exams, and so you're certainly welcome to go to your primary care doctor, such as we have with Dr. Poulos and your assigned primary care doctor. But also available are other services, and you'll see those on the screen in front of you, such as Aunt Martha's in Carpentersville, and there's a contact number there. Greater Family Health, which is a federally qualified health center that Elisa will define for us, and VNA as well. And then there's also the King County Health Department, where you can go and get those exams and those vaccines. Disponibles, ¿dónde están disponibles estas vacunas? Pues están disponibles con su médico de cabecera, tal como es la doctora Poulos, y como ustedes a lo mejor ya tienen asignado. Pero si no tienen, pueden ir a cualquiera de las clínicas. Está la clínica Aunt Martha en Carpentersville, ahí está su número de contacto. Está también la clínica de Greater Family Health y la clínica de VNA. Y también está servicio por parte del condado de Kane County, el Departamento de Salud, y ahí están los números de contacto, ¿verdad? Aparte de esto, we also have, for dental exams, WellChild, WIC, the WIC office that we normally refer to. And on here I have their address. You will see it in the slide that you are seeing. They take children from birth to age 18, and they will also take special needs children up to the age of 21. And I've listed here all of their dental services. As you can see, they're all bulleted there. And they will take Medicaid, and they will take all kids insurance. And for families of limited means, they will also offer reduced fees available. Como verán, la clínica de WellChild, que es conocida como WIC entre todos nosotros, ¿verdad? Aquí está el domicilio, y ellos también ofrecen servicios dentales. Aquí verán que ellos aceptan niños desde nacimiento hasta la edad de 18 años, y al igual niños con necesidades especiales hasta los 21, y aquí hay lista punto por punto de los servicios que ellos ofrecen. Verán ustedes que ellos aceptan el Medicaid y la aseguranza All Kids, y también tienen tarifas reducidas para las personas, las familias de recursos escasos, ¿verdad?
Is that on Wing Street?
That's on Wing Street. Está en el 620 Wing Street, que está en la intersección de la State Street, la 31 y la Wing, ¿verdad? So it's located at 620 Wing Street, right at the intersection of State Street, Route 31, and Wing Street. That's where their main office is, and that's where the dental clinic is for sure. Because I know WIC has many locations, right? But this
the dental
one is specific to this location, okay?
As what we do. We also have dental for kids and adults, but it's in a row.
Okay.
It's a little ways.
I think this Greater Family has one too on the street, not on Summit, the street that's one block
prior.
Oh yeah,
Seneca.
they're behind the CVS and the Amico, the BP station. So there are several options for people with limited resources. Como dicen, la enfermera Elisa nos dice que la VNA también tiene clínica dental, solo que está localizada en Aurora. Y la doctora también nos recuerda que Greater Family Health también tiene clínica dental. Ellos están en la intersección de la Summit y la 25. Dundee. Exactamente. Un poquito más, la clínica de WellChild tiene una oferta en especial para las personas. Let me go to English first. WellChild offers a dental clinic with a $75 full service exam. And that includes, it's a complete exam, x-rays, dental cleaning, fluoride treatment, and dental education. So again, for families with very limited resources, they will offer that fee of $75 for that type of an exam. En la clínica de Well Child, para las personas de escasos recursos, ellos ofrecen un examen completo dental por $75, que incluye el examen dental, radiografías, limpieza dental, tratamiento de flúor y educación dental. Entonces, para familias que no tienen seguro médico dental especial, sí, para niños. Todo esto sigue siendo para niños de 1 a 18 y de niños con necesidad especial hasta los 21. So that is a good point that these, again, are services that are targeted at children ages birth to 18, and then as well as special needs children up to the age of 21. And again, this specific service is targeted for people that don't have dental insurance. Familias que no tienen seguro dental pueden acudir al Well Child para hacer esto. Entonces, esta es la información que tenemos que compartir. Remember that you have to make your appointments right away. Don't wait till the last minute, because we only have a month to go, and they do want all of this paperwork in prior to the start of the school year. Recuerden que hagan...
They do take them out of school.
No los permiten en la escuela. They will not take you into school if you don't have your exams ready.
And all the health centers and the doctor's office get booked.
They're booked. So
yes,
if you leave until the last day, you end up either with your child missing school,
yes,
or going to an urgent care, which can also provide this service, but it's probably not going to be as economical as some of these other
waiting,
options.
Procrastination is not going to be a good time to do this.
But that we should mention, there's those centros de cuidado urgente, que hay varias en la comunidad que sí ofrecen eso, pero cierto que no va a costar más que lo que ofrecen.
Más caro.
O sea, recuerden que tienen que hacer su cita y háganlo ya, porque queda menos de un mes y van a estar saturadas las citas, y es importante, no los van a dejar empezar la escuela, no les dan el schedule, y como dice la doctora, tengan que acudir a un centro de urgencia o algo para que se los hagan una clínica, les va a salir mucho más costoso.
O posiblemente, yo creo que
posiblemente, sí. Pero es bien importante que lo hagan lo más antes posible. Okay? And now we'll turn it over to our friend here, Elisa Lara, who is going to be talking to us about where we can go and get services like this.
Yes, and this is wonderful because we have options. We all know when we go to the doctor's office, we have our doctor that we've had for a long time. But sometimes we lose our insurance, or sometimes we move, and we need to start again to a new location. And what's really nice about this is that there's always options. And I am from a federally qualified health center, VNA Health Center, and we service the whole family. It's like a one-stop shop. And it's really nice because at our facility, we actually have WIC, we have different services there that we provide, but a child can come to make an appointment, a mom can come for her woman wellness check. We can have the dad come and get his whole physical done. We have behavioral health. So we have from peds, OB, if you're pregnant or you need even need birth control for women, or if you need a pregnancy test, we even do those. So it's such a variety of services that we do for the whole family, which is really nice. And if you don't have insurance, that's not a problem. We want to make sure that we service the whole family, that money should never be a reason why we don't get...
It's a sliding scale, right?
Yes, so that's if you don't have insurance, it's based on a sliding scale. You bring your check stub, they look and see how many family members live with you, and then put you on a scale, and that's how they charge you. So it could be, let's say, anything like from $25, $30 to $100 something, So it's just a scale depending on where you fall. If you don't have a job, then you can write a letter, and that's a whole different option as well. But we do take insurances. There's a variety of insurances that we take that are PPO, HMO, so we can be a primary care for different people who are insured. And then also for people who have Medicaid, Medicare, we also do that as well. So it's a really nice option for people who can come, and it's an outpatient clinic where they can come and get the different services. We are doing physicals, as we were talking and mentioning. Hopefully we don't have to wait that long, because people do come, and sometimes our wait had been long. So now we're really focusing on trying to get appointments, because sometimes we'd have the long line outside the building because everybody was waiting till last minute. So hopefully we all are focusing on getting this prevention and making sure we avoid that
And again, these
issue.
are federally qualified health centers. So again, if you don't have a primary physician already assigned to you, you can go to the clinic. They're full-service clinics that have many services as you've just listed, right, Elisa?
Yeah, and
Okay.
we're lucky because in our area,
We have
we
two.
actually have three.
Three.
We actually have three, and when I came to town, there were like 0.
We have a big population,
Yeah.
so we have a
Yeah.
lot to serve, a lot
Yeah.
of communities, so that definitely is.
Yeah.
Y estamos hablando un poquito de los servicios que hay diferentes médicos. Muchas veces nosotros tenemos nuestros doctores de cabecera que realmente se tiene por toda la familia y lo hemos tenido por años. Pero a veces se nos pierde la aseguranza, que ya no la vamos a tener, nos cambiamos de ubicación o simplemente ya no tenemos los servicios que teníamos con el doctor o queremos cambiar en sí de médico. Y lo bueno es que aquí en nuestra área tenemos una variedad de servicios y tenemos lo que le llaman las clínicas federales, más bien, que están enfocadas en servir la comunidad. Y tenemos opción, la clínica donde yo trabajo se llama VNA, y en sí tenemos servicios para toda la familia, incluso tenemos como para la mamá si quiere venirse de un chequeo de mujer, un papá Nicolau, revisarse los pechos y todo lo que se debe hacer anualmente. Tenemos el pediatra, tenemos en sí para que si una mujer está embarazada, los servicios de ginecólogo, tenemos de salud mental, incluso tenemos hasta una farmacia, que no mencioné eso
sí.
también, que es algo nuevo que tenemos, y incluso sale mucho más económico. Para una persona que no tiene aseguranza, va a base de los ingresos, cuántos son de familia, y así es como se le van cobrando cada visita. También aceptamos aseguranzas de todas variedades, porque tenemos el HMO o lo del PPO, o personas que simplemente tienen la tarjeta médica o el Medicare, lo que le llaman para las personas de tercera edad. Nosotros, nuestro enfoque es asegurar que no hay una persona que no obtenga servicios médicos por falta de dinero,
recursos.
que recursos que no tengan, porque realmente es importante que todos recibamos. Y es lo bueno que realmente tenemos esa posibilidad de servicio. Una persona no está trabajando, escribe en una carta, no esté trabajando, y nosotros buscamos una forma de poder ayudarlos. Como estaba mencionando anteriormente, hasta dentistas podemos hacer, tenemos la visión en Aurora, son servicios que proveemos, no exactamente aquí en Elgin, pero trabajamos igual en Aurora. Tenemos diferentes ubicaciones en la comunidad.
Y como nos recuerda la doctora Poulos, somos muy afortunados aquí en el área de Elgin de tener 3 clínicas
Que ofrecen eso, ya.
Federales, que sí, en sí
Sí,
somos
sí.
varios, ¿no? Tenemos una gran población y necesitamos más.
Sí, necesitamos
Y
más,
también,
es cierto.
And just, and I think another thing that people are often not very clued in on is that for those people that want a private physician and are moved to town, are looking for a new physician, things have changed greatly from the way it was, say, before the internet and before managed care. In the old days, you'd come to a new town and you'd ask your neighbors or you'd ask some relatives or somebody you'd get, and you just would make an appointment and go. It's not that simple anymore, even though those aren't bad resources, but people really first should look at who is their insurer, who's on the panel, which hospital they have to go to. There's a lot of limitations now with insurances that people aren't clued into. And in general, there's more limitations with HMO than PPO, but even with PPOs, there's something called preferred panels and not preferred. So before you get your heart set on one physician or one group, make sure that your insurance covers them, especially if you're new in town, or if your physician is retired and you're looking for a new physician. Don't just say, oh, my neighbor likes Dr. So-and-so, I'll make an appointment. You might be very disappointed if you don't do your homework and at least call up the office and say, hey, do you take, this is my card. The second thing that is new in the world of finding a doctor is I would caution you to be careful with internet-based interviews or scores, because if you've used them for like TripAdvisor, you know that there can be a place that you really like as a restaurant and it gets a horrible review and then no one wants to go because one grumpy person had a bad experience. So be careful or take with a grain of salt when you read the comments, because, and especially I would go more for like the number of comments that are positive versus negative, because one person that has perhaps a legitimate beef won't be reflected by 10 others. So just be cautious with the internet, because the internet can be gamed, and those scores, there's even automated systems like bots that can put numbers into scores. So from what I've heard, would be absolutely incapable of doing anything like that, but so I hear. To talk to people, para hablar con personas que no tienen bajos recursos y tienen aseguranza particular o la Medicare, hay que tener cuidado. Before I go inside, just to finish up, be careful also with Medicare. Medicare isn't what it used to be. There's traditional Medicare, but if you have chosen a Medicare Advantage plan, that functions very much like an HMO. You have panels and you have limitations. So likewise, if you're thinking of switching your Medicare plan and you really like your doctor, call the office first to make sure they're in the Advantage plan you want to switch to. Don't trust the person on the phone, the salesperson. Call your physician's office. So, para los pacientes que tienen aseguranza particular o la Medicare, hay otras cosas de tener pendiente. Uno es que el mundo no es lo que era hace 30 años. Casi todos tienen un tipo de aseguranza limitado, HMO, pero también la aseguranza de tipo PPO tiene un panel limitado, y es muy importante antes de escoger un doctor por su vecino, por su amiga, por su suegro, lo que sea, de averiguar que es una persona que está en su plan. También la segunda cosa es de no prestar demasiada atención en lo que se ve en el internet, como las revistas en la internet, porque a veces esas, por ejemplo, a mí me ha ocurrido por ejemplo, con un restaurante que yo conozco muy bien, que una persona se va y no está contento y pone unas cosas comentarios bien negativos, pero hay otras 10 personas que dicen que está ok. Lo mismo ocurre con doctores, y que no es que la persona está mintiendo necesariamente, pero la experiencia de una persona no es suficiente para juzgar toda la clínica o todo el doctor, todos los doctores en la clínica. Y también especialmente por los pacientes que tienen la Medicare. Con la Medicare tradicional, que es parte A, parte B, un plan suplementario y parte D por las drogas, se puede ir a casi cualquier lugar. Hay otro tipo de Medicare que se llama Medicare Advantage, tiene sus ventajas, que sí o que no, pero hay que tener mucho cuidado porque este plan funciona bastante similar como un HMO, es que tiene un panel más limitado, y si están pensando de cambiar a su plan, hay que hablar con la oficina del doctor o la doctora para averiguar que están en el plan, y de no confiar totalmente en la persona del teléfono que le está tratando de venderlo, porque a veces a mí me ha ocurrido que dicen los pacientes información que no es correcta.
Sí, es cierto. Entonces, as you can see, there are several options for where we can go for these medical services, from a private doctor to a federally qualified health center. And I think you forgot to mention in English that at VNA you have a pharmacy right now.
Yes,
right?
I didn't mention that. We do have a pharmacy, which is really wonderful because it does do great discounts. So that's something that we've always actually worked with, in making sure that our patients receive, the best care and inexpensive. So we try to assure that they get less.
And what are the federally qualified centers we have here in Elgin?
So we have Greater Elgin,
Greater Family,
Greater Family, and then we have VNA Health Center, and then also
Aunt Martha's.
Aunt Martha is
In
not
Carpenter
really
Hill?
in Elgin, but
Yeah. Close
it's
enough.
nearby.
Close
It's
enough.
yeah, 15 minutes away. So those are the ones that
Okay.
are the most.
And
Okay.
the other thing that I thought about that I should have mentioned, I didn't want to assume, that for RSV, people might saying, like, so what is RSV? A surprising number of adults have RSV and don't know it, and have either, a bad cold, people say, well, I'm not sure I want to get a shot for a bad cold, but how about bronchitis that lingers forever, or a pneumonia that lands you in the hospital, especially the older you get. So that's why there's been this urgency or this interest in the vaccine. Lo que quiero mencionar es que por los adultos no hay que pensar en RSV como si fuera solamente un catarro y no vale la pena vacunarse. Hay bastantes adultos o personas de tercera edad que cada año se ponen en hospital con pulmonía con este virus. Por eso yo creo que vale la pena pensar en eso.
Okay. And Elisa, what is the intake process for somebody going into a federally qualified health center?
As I was saying, since if you don't have insurance, Ideally, we do need to make an appointment. We do
Okay.
have a certain amount of walk-ins. We need to have a walk-in provider, so it's ideal to schedule an appointment first of all. So when you call in, they'll ask you lots of questions. If you have insurance, and make sure that we do accept your insurance. And if you don't, then you actually bring a check stub, and it's a recent check stub, maybe 1 or 2 from the last recent check stub that you may have. And then there's a form that you'll fill out, how many family members you have, and then they take account how much your income is, and then that's how they do the rate scale, and that's how they start processing you. We put you with a provider, and so it's really not that difficult.
Elisa, ¿cuál es el proceso para ir a una de estas clínicas federales?
So, realmente es algo muy simple, como estaba mencionando anteriormente. Si no tienen aseguranza, idealmente queremos asegurar que hagan su cita, porque ahorita es muy difícil venir sin cita, especialmente porque no siempre tenemos los doctores suficientes para que vengan sin cita. Pero hagan una cita por teléfono, le van a hacer unas preguntas, si al caso tiene aseguranza, si no tienen aseguranza, y realmente trae unos talones de cheque que sean recién, unos 2 talones de cheque más o menos, y ven cuánto es su ingreso, cuántos son de familia, y así es como va pasando cuánto les va a costar la visita. Pero si tienen aseguranza, también tomen en cuenta cuánto es aseguranza, ya sería solamente lo que es el cobro que se hace cada visita. Pero realmente la cita es muy fácil para venir con la clínica, es que con que llamen y hagan la cita, nosotros les ayudamos y apoyarlos en ese aspecto.
Muy bien, muy bien. And then we also need to just send out a reminder that while the Medicaid certification was kind of suspended for the 3 years of COVID, it is now back in force. So everybody who qualifies for Medicaid needs to go back and recertify so that you have uninterrupted services. Les queremos recordar que durante el tiempo del COVID se suspendió la certificación del Medicaid, pero ahora que ya va pasando, pues ya quieren que cada año vuelvan a certificar como lo hicieron antes. Entonces, para no tener interrupción en servicios, es importante que se vuelvan a recertificar en el proceso de Medicaid, ¿verdad? Quisiéramos hacerles saber que pronto vamos a publicar las sesiones que vamos a tener en temas de salud, para que estén al pendiente del correo electrónico que mandan la biblioteca, del folleto que mandan por correo. We want to remind everyone that we will be publishing our upcoming dates for Health Talks, so be on the lookout for the Gail Borden newsletter, as well as an email that will go out and will publish the dates, so that you can be on the lookout for when we will be engaging next on a pretty regular basis. And I would like to offer to you that if you have any questions, feel free to either put them in comments or send them directly to me at mmartinez@gailborden.info, and that will be in our comment section, so that you can easily address a question to any one of us, and I will make sure that I get the question to the appropriate person and get you a response back. Queremos también ofrecerles que si tiene alguna pregunta acerca de la información que hemos platicado ahora, o también temas que quieran cubrir en el futuro, que por favor manden esa información. Me la pueden mandar directo a mí, a mmartinez@gailborden.info, y vamos a poner ese domicilio en los comentarios para que fácilmente manden esas preguntas, y si es para la doctora o para Elisa, yo me aseguro de que nos contesten y lo publicamos. Entonces, gracias por toda su participación, y seguimos adelante con temas de salud. We will continue forward with our health talk, and if you have any topics that you wish to discuss also in the future that you would like us to cover, please feel free to share them with us. Thank you. So, gracias, doctora Poulos, que nos acompañó esta noche. Gracias, Elisa. Thank you, Elisa, for joining us. Thank you, Doctor, for joining us this evening. And thank you, all of you. Have a great National Night Out. Okay? Bye.